Are you seeing sufficient scale and pace of progress of embedding the Act within the health sector? And can you outline the work that you've undertaken to accelerate progress in that area, please?
I think that the short answer to that is no. We're not seeing significant pace and scale of change. We are seeing that health boards are considering the Act very much as a kind of sideline issue. Some of them were reporting it almost as a kind of separate thing. That has started to change. They're now integrating their reporting. Some health boards, back probably about a year ago, were not even meeting the bare statutory requirements of the Act, which was to set objectives and then set out the steps they were going to take to meet those objectives. They are now doing that, but you know that I'm just trying to give you a flavour of the extent to which health are embedding the Act or thinking from an early stage about it. I'm not sure. Were you? I'm not sure if you were here when I was giving some quotes about what the health bodies are saying. Would you?
No, I don't. No.
Okay. So let me start first with some of the things that we have done in terms of this healthcare system. So we've worked closely with the Welsh Government NHS planning team to revise the guidance around setting of the integrated medium-term plans, because the guidance made no reference to the Future Generations Act at all, and this is part of the challenge that we're seeing. And Mark, I want to pick up on your point a little bit in this answer as well around the sort of outcomes. We are spending a huge amount of our time having to unpick a system which is at odds with the Future Generations Act. So before we can almost even start to get to cultural change, the guidance that they're required, you know, on WellTag, on planning policy, on IMTPs in this case, is at odds with the Future Generations Act. We're working with the government and others to try to get that guidance fit for purpose.